Welcome, Keynote.
Hello,
Thank you.
Jeff Dunn here. It's my great pleasure to join you, each and every one of you, at this 2024 National Cancer Congress in Malaysia. I'm terribly sorry I can't be there in person. I offer you my heartfelt apologies and wish you a terrific meeting. It's also my pleasure and privilege to serve as the President of the Union for International Cancer Control, and in that capacity I want to congratulate the organisers of this important meeting, all of you, for pulling it together, and on such an important theme about bridging gaps and building hope and empowering lives. Three important platforms which are axiomatic, central to our combined collective work in cancer control. I've been invited to present briefly on the importance of partnerships, and I'm looking forward to sharing that with you today. Because if one thing's for sure and for certain, that the future to global cancer control rests in each of us sharing our knowledge, sharing our experience, and working closely together to make sure that collectively we do make a difference. So building global partnerships and comprehensive cancer control strategies, challenges and opportunities, and I'll provide you with a UICC perspective, given that the National Cancer Society of Malaysia, of course, is a long-standing, highly valued contributor, member organisation to the UICC. So I have some slides. Bear with me while I just share my screen. So the UICC, as I mentioned, it is my great pleasure to serve as the president, an honour which I've enjoyed for the last year and a half, and I do step down in just after the World Cancer Congress this year in September, October. Hoping to see you all at the Congress, but more about that later. UICC, it's the oldest, largest cancer fighting global organisation. It was founded 90 years ago, in fact. We've just celebrated our 90-year anniversary. It's a non-government organisation. We've got a team of about 45 staff based in Geneva. We've got over 1,000 members in 170 countries. And that membership represents tens of thousands of people. Our membership is organisational, not individual. We've got 60 partners, which are key cancer control organisations, and we'll talk about that in a little while. And we have official relationships with the United Nations, which gives us access to organisations and agencies like the UN, IARC, IAEA, and others. We are leading the global action on cancer control, and that's what we do. We're unique because we're the only global cancer organisation that represents across the board, and we have contact with influential health leaders, both in industry, in government, in health agencies, in health service providers, at the local level, at the national level, and at the international level. We are connected through partnerships and through our membership. Our mission is to unite and support the global cancer community to reduce cancer burden, to promote greater equity, to ensure that cancer control continues to be a priority on the World Health and Development agenda. And that's very important, to make sure that cancer remains a priority. Just so you know a bit about us, we have a board of directors which spans the globe. As I mentioned, I currently serve as the chair. The president-elect is Ulrika from Sweden, and she takes over in September, and I can assure you, leaving the organisation in very good hands. Our board of directors, our current one, as you can see, from Switzerland, UK, Canada, Brazil, Lebanon, Portugal, Nigeria, Canada, India, Brazil, again, Kenya, Jordan, Mexico, around the globe. And can I acknowledge up front, again, Dr. Sundari Somasundaram from the National Cancer Society of Malaysia, who was a past board member and a great supporter of our work. UICC membership incorporates all sorts of organisations, cancer societies, for example, like you in Malaysia, but we have other members in Malaysia too, and around the world. And I know that at this meeting, it's not just organisations, individuals and health service organisations from Malaysia, but from around the region and beyond. So to acknowledge people who are attending and from different sorts, whether you're academics, whether you're a clinician, you know, a patient or a patient support group advocate, you know, a member of a cancer society, every one of us has a role to play. I'm not sure how much you'll be talking about the global burden, so I won't touch on it in detail, but, you know, really, just to note that there is more cancer out there. You know, the projections for cancer are all on the up. There's going to be more cancer diagnosed. There's going to be more people, sadly, who die from this disease. And importantly, as we get better at campaigning and fighting and curing cancer, there will be more people surviving this disease for longer periods of time. So prevalence will also increase. So at the moment, there's about 20 million new diagnoses each year, about 10 million deaths. By 2040, that number is going to be 30 million cases. Importantly, and an issue for each and every one of us interested in cancer control, about 40% of those deaths are preventable. I mean, when you think about that, that's at the moment, that's potentially 3.7 million lives we could save every year if we could just put into practice the evidence we currently have about prevention of this disease and about its early detection, where we can actually make sure that we get the greatest possible choice we have with how we treat that, best possible outcomes from a survival point of view. So there's a lot of work for us to do, and I know that's uppermost in the minds of each and every one of you there. If you look at these trends, you know, the less developed countries are actually going to be bearing, you know, much of the burden. So there's going to be more cancer cases in the less developed world, in low and middle income countries. And sadly, 70% of mortality into the future is going to be in low and middle income countries. So in countries like Malaysia and in countries in the rest of the Asia Pacific region and in LMICs around the globe, are they going to be carrying, they're going to do the heavy lifting in many ways. And that's important for each and every one of us. And of course, the economic cost of this, well, how do you put a cost on it? I mean, economists try and tell us a number, you know, and at the moment it's sitting about 1.16 trillion annually, the cost of a cancer burden. But, you know, how do you calculate a cost in human terms? For individuals, for partners, for families, for communities, which have faced the, you know, terrible news of a diagnosis of cancer and what that means on a daily basis. The UICC has for the past 3 years run a World Cancer Day campaign on closing the care gap, which is important to us. And there's important reasons for this. I mean, half the world's population right now lacks access to full range of essential health services. You know, the WHO has published an essential medicines list. You know, these are the medicines which they believe are essential for the proper care and treatment of people diagnosed with cancer, but much of the world's population still does not have access. There are consequences for these gaps. We need to address them. This is a busy slide, and I apologize, but just look to the two bottom dot points. You know, while the overall burden grows, so do inequities. And the inequities, the difference between high and low and middle income countries is growing. And that, you know, that's something we need to address. And there are significant variations in unmet supportive care needs around the world. So not just about the prevention, early detection, treatment, and management of that disease, but also in survivorship, because as more cancer is diagnosed, and as we get better, whether it's in high-income countries or low and middle-income countries, as we get better at treating this disease, there will be more people living longer with the potential impact of that, the morbidities, the side effects, you know, the decrements in quality of life and well-being. We need to actually understand that. We need to think about that. Again, this is a busy slide. But I suppose, once again, I could ask you to focus on the bottom two dot points. A matter close to my heart as, a survivor myself now, and as someone who's been working in cancer survivorship research for 30 years. 1/3 of all cancer survivors will experience symptoms after treatment. Some of them clinically significant. Up to a third of cancer survivors experience clinically significant levels of distress and anxiety. They can also experience things such as, mood disturbance, sleep, pain, cognitive limitation, and disruption. For some cancers, interruptions or bother in relation to continence, sexual function. And all of these things can place a great burden on family and relationship issues. These are things which we must understand. And of course, it's not just patients, it's about caregivers. And we know that for some cancers, the levels of distress and anxiety experienced and reported amongst caregivers are actually greater than the cancer patients themselves. So I put in a plug for the importance of survivorship work when we're thinking about cancer. It's important we prevent it where we can. And then it's essential we do whatever we can to detect it as early as possible to give ourselves the best chance of successful treatment and improved outcomes of therapeutic management. And again, we also need to make sure that we look after the person after treatment, after diagnosis, to make sure that we improve the quality of life, give them the best possible chance of a life full of well-being when a diagnosis has been made. And just by way of example, we have been pushing at the UICC for some years about the importance of national cancer control plans. When we do a review of those, and this is a recent publication and quite a good one, I must say, of the 237 national cancer control plans, this article found of the 237, less than, around less than half, around 40%, actually spoke about psycho-oncology or well-being or quality of life. And of those, 40% of plans, less than half, well, only half of them actually, gave reference to psycho-oncology, had a general reference, and then only a small percentage of those actually had substantive, survivorship content, specific targets or articulated goals. So we've got a long way to go in the survivorship space, particularly when it comes to state and national planning. And I do offer that to you as an area where we can make a difference. And of course, we need you involved in this in every aspect of cancer control, because to make a difference, it takes each and every one of us. And here's some shots of members around the world getting involved in our activities, whether it's in South America or Africa or in Asia Pacific. Each of us and each of our member organizations are critical. The UICC approach is to support the cancer control community through driving global impact. And that's what we're hoping to achieve. Members, for the member organizations out there, we provide a whole range of things to build member capacity through online learning, through grants, fellowships, leadership development, national advocacy and support, patient group mentoring, webinars and meetings, T&M, which the Jim staging, which is a very important document, so discounts there, access to UICC events, and certainly, voting rights in our organization. Our current learning and development portfolio, and that may well be of interest to many of you. It's about our Young Leaders program, which is, always a highlight for us, investing in the young cancer leaders of the future, and delighted to see that we often now have young leaders graduating to serve on the board of the UICC and taking up influential roles in global cancer control organizations. Our fellowships, our training opportunities, supporting national advocacy, the online learning, regional engagement. So regional meetings, again, my apologies for not being able to join you in Malaysia at this meeting. Organizational leadership opportunities, grant opportunities, patient engagement. We certainly understand the importance of patient groups and patient engagement, our virtual dialogues, and there is a focus right now on women's cancers. We look to share knowledge, and we do this through a range of publications which you may be well of, particularly the clinicians out there, about T&M, which is once again one of the things that's most highly valued around the world from our clinical fellows, the International Journal of Cancer, and a whole range of resources and publications. We actually unite the global cancer community through our World Cancer Congress. And the last one was in Geneva in 2022. Unfortunately, I couldn't attend because I was under treatment. But we're having the next one, and it's in Geneva again, mainly because, at the time when we had to make the decision about Geneva, about where the next Congress was, the 24 one, we were still coming out of the COVID era and weren't quite sure how that would look in 24. So we decided to keep it close to our office, which is in Geneva, one more time. I can assure you that we've been considering bids for the 2026 World Cancer Congress. It is not in Geneva, and there will be announcements soon about where that will be. And I'm sure you will be pleased with the destination when that is made public. World Cancer Leader Summit. We just had one in Long Beach last year. Next year, the World Cancer Leader Summit is down my way in Australia, in Melbourne. So I do hope you're able to join us. World Cancer Day is a very important day in our calendar, February 4. I'll talk about that in a little while, and certainly regional dialogues. And keep an eye out for our regional dialogues in the Asia Pacific region. Again, they are well attended. This is a photo just of our World Cancer Congress in Geneva in 2022, and I do hope you're planning to join us in Geneva again in September this year for our 2024 World Cancer Congress. It's going to be a terrific meeting, and you will enjoy it. We have some targeted commitments, and I think it's important to note that, we engage the UN, UICC member civil societies and others in coming together to try and, build what we can to make sure that we make some difference out there in cancer control. We have a World Cancer Declaration. I can tell you that we're actually refreshing it. It was first developed in 2006. The World Cancer Declaration was refreshed in 2017, and we're looking at another refresh now. We'll be coming back to members about the World Cancer Declaration, about World Cancer Resolution, about the global strategy to eliminate cancer of the cervix. And we're working very closely with the WHO on that, as we are with partners on the global action on NCDs. And there are important UN and WHO meetings coming up on those. It's the WHO's Global Breast Cancer Initiative. And through that collaboration, we're looking to make some substantial gains. And of course, we're working closely with member organizations on the revision of the Sustainable Development Goals. Now, we need members to influence these global agendas, and we can't do it alone. Each of us needs to stick together, which is why global partnerships are so important. I think about the global strategy to eliminate cancer of the cervix. Well, what a thing. Imagine if we're able to eliminate cancer of the cervix. And I know there are some countries who are trying to do that now on a national basis. And that's actually something that they're almost there at. It's just around the corner. And globally, we can do it. But I tell you what, we're all going to have to work together on that. And I encourage you to do that with us. At the UICC, we established, as you know, we've been involved in establishing and joined with others in establishing some key international agencies. CCAN, the City Cancer Challenge, is something we established and then set up as its own organization just a few backs. The NCD Alliance, we're a founding member. McCabe, a Centre for the Law and Cancer, which is based in Australia, but a key partnership of ours, and the International Cancer Control Partnership, which we have been running for some years now. And we have just started and just launched MATM, which is an acronym for Access to Oncology Medicines, to make sure that around the globe, we try and make sure that all people, have access to affordable medicines. And we're working with industry, with member organizations, with national governments to try and bring about access to affordable cancer medicines. Current areas of focus for us are antimicrobial resistance. If you think about the fact that the leading cause of death for cancer patients, other than their cancer itself, is infection. AMR is an issue for those of us interested in cancer control. And we are working with the UN, with the WHO, and there are some important meetings which we are partnering again with members and with the WHO to try and bring about some improvements. We are working on the breast cancer initiative I've just mentioned and cervix, essential cancer medicines, which are key for us, tobacco control. You know, at the last meeting of the FCTC members, the Framework Convention on Tobacco Control, they started to talk about the end game for tobacco. We need to think about that too. And there's been developments around the world, some in Australia, some elsewhere, some in the UK, about vaping, about the use of vapes, and about screening for lung cancer. We need to make sure that we encourage global action on that and bring members along. Universal health coverage is important for us. And again, you know, there has been lots of discussion in the region and globally. And of course, investing in cancer control and the importance of national cancer control planning. We have seen movement, but we need to see more. We can't do any of this without partners. Partnering is the key to success. Cancer societies, networks, UN agencies, international organizations, governments, companies, private foundations, academics, clinicians, support groups, associations, research and treatment centers. Each and every one of you in this conference, participating in this meeting, you are joined in this, and by your participation, a part of this group. You have a role to play. Identify what this is and do what you can to partner to bring about some change. And here are some logos just to show you the breadth of our UICC partners, and we're proud of each and every one of them and our members who seem to be finding membership of the UICC a valuable, enjoyable and productive activity. But of course, we can always do better. And we're continually on the lookout for feedback and advice from member organizations about how we can improve our activity. I mentioned before about World Cancer Day. We finished World Cancer Day's 3-year focus on closing the care gap in February of this year. In 2022, we focused on realizing the problem. In 23, it was about uniting voices to take action. In 2024, we said about challenging those in power, governments, and policymakers, industry, to actually do something to help us close the care gap. And, you know, we've had some good success and the metrics are positive. We've got a new theme starting in 2025. I can give you a preview. We have got a people-first approach. We are putting patients at the center of this, and it's rooted in empathy and compassion. And World Cancer Day 25 through 27, I can tell you, will be about being united by unique. You think about that. Each of us are unique. Each cancer patient is unique. Each member, each experience is unique. And there'll be much more coming your way about World Cancer Day and about united by unique. Keep an eye out and please do participate. Our long-term strategies at the UICC about collaborating with UN agencies, high-level meetings, and sustainable development goals to get our agenda, cancer control, on those major agendas. It's critical and it's important. We are also encouraging and enabling governments around the world to take action and to make sure that we've got effective plans in place, national cancer control planning, and engaging with cancer control communities and other NCD organizations to overcome the harms that are being caused by modifiable risk factors. We must do more about this. We can make a difference. We can reduce the burden, and we need to look at modifiable risk factors. We need to think about, how we can get on about closing the gaps in prevention, early detection and treatment, and about making sure that survivorship, quality of life and well-being after a cancer diagnosis and treatment is something that each and every one of us can enjoy and experience and benefit from, not just those of us in certain areas, countries and populations. We need to consult with industry and business to make sure that they're a part of the solution. They're partners with us. And I tell you what, probably key among all these things is about inspiring and working with our global cancer community. And that's you, each and every one of you, to raise our voices in unison, to secure resources, to embrace opportunities, to improve communication, to advocate for change, so that collectively we can achieve that overarching, that heartfelt desire and ambition to deliver cancer control on a global basis. If you're interested in more about the UICC, here's a QR code that you can access, and please go to our website, uicc.org, to learn about how you can contribute and what are the opportunities to help join together to make a meaningful contribution to global cancer control. So friends and colleagues, again, my apologies for being unable to join with you in person. I salute you for taking the time to participate. I encourage you in your efforts, and I really do hope that we can engage you ever more so in our shared collaborative adventure, which is to control cancer globally. And we need, as you have said in the theme to this conference, we need to bridge gaps, we need to build hope, and we need to empower lives. And by doing those things collectively and together, there is no doubt that we will make a difference, that we will control cancer, and we will make the world a better place. Thank you, one and all.